So first of all, I've drawn here fluid movement and IV solutions. So there's three different IV solutions that we have: isotonic, hypotonic, and hypertonic. Now I've drawn a blood vessel here and a cell right next to it. So you can see the difference of how the fluids will move. So first of all, isotonic IV solutions that have the same concentration as the plasma. So in a beaker, it would look the same. So there would be the same concentration of either sides. Hence, there will be no fluid movement. The body will strive for homeostasis, but since the concentration of the IV solution that we're giving the patient is the same as in the intracellular space or as the serum osmolarity, fluids will not move. Hence, so there's no fluid movement and the fluid stays in the intravascular space. Now the two only isotonic IV solutions are 0.9% sodium chloride, also called normal saline, and lactated Ringer solution. Now the difference is that 0.9% sodium chloride or normal saline contains sodium chloride only, whereas lactated Ringers contains some more electrolytes, as well as maybe some bicarbonate and so forth. So depending on whatever the patient needs, the physician or the provider will determine what kind of isotonic solution the patient should receive. Now the indication for isotonic fluid administration is typically fluid volume deficit. So if everything is too concentrated in the patient, we want to kind of dilute it out a little bit, and we want to give the patient some more isotonic fluid in the intravascular space. So indications will be dehydration, that can be due to nausea, vomiting, diarrhea. It can be due to fever, drains such as from wounds, or suctioning such as from an NG tube or so forth. Now, the second principle or the second type of IV solutions we have here is hypotonic IV solutions. And hypotonic meaning that the concentration is less than the serum. So if we give the patient hypotonic solution, so you see I've only drawn 3 particles here, so there will be more fluid than particles administered to the patient. By the principle of osmosis, as we have discussed earlier, osmosis will move water in and out of the cell. And because with the patient, giving the patient now a hypotonic solution, meaning the particles are less than the fluids that we're giving them, fluid will move inside the cell. Because again, the body is striving for homeostasis. So examples of hypotonic solution is 0.45% sodium chloride, also called half normal saline. Makes sense because normal saline is called 0.9% sodium chloride. So it is a hypotonic IV solution. Another example is D5 half normal saline. And D5 means that there is 5% of dextrose in the solution, and then again the 0.45% sodium chloride. Now keep in mind the dextrose here gets used up by the body right away, and therefore really as soon as this IV fluid hits the patient's veins, the D5 is taken up, is used by the cells for energy, and the half normal saline remains, meaning that it is a hypotonic solution. Now hypotonic IV solutions, you'll see that a lot used in patients who might be going to surgery or just for regular IV maintenance fluid. And as you can see here, I wrote normal daily losses such as from perspiring, sweating, GI tract, fluid losses through respiration and so forth. They are hypotonic. So then if we replenish the patient with hypotonic solution, everything will reach homeostasis just like the body wants to. Hypotonic solutions can also be used at a higher or at a faster rate if there is intracellular dehydration. So if the cell itself is dehydrated, it will need more fluid. By us administering hypotonic IV solutions, we'll give the patient, again, a lower concentration of particles, higher concentration of fluids, and that fluid, by principle of osmosis, will move into the cell. One important principle here is to remember, just as we can only measure electrolytes in the patient's intravascular space, the only way that we can control the fluid shifts is by administering these IV solutions into the intravascular space, and then we know by the tonicity or by the concentration of the fluids that we give the patient, certain fluid shifts are going to occur. So now let's look at our third IV solution here, which is a hypertonic IV solution. So hypertonic meaning more concentrated. So now we're going to give the patient an IV solution that has more particles, is more concentrated than it has water. Again, by the principle of osmosis, the body wants to equalize that. So now we have a higher concentration in our intravascular space, hence the body is going to pull fluids from the cell into the intravascular space to dilute the intravascular space and make it again even. Now, why would we want to dehydrate the cell? There's really only two major indications as to why you would administer hypertonic IV solution. Number one, severe hyponatremia. So if you have a patient who has a sodium level typically of below than 120, you will want to give the patient a highly concentrated sodium chloride solution, which in our case is 3% sodium chloride. So that's much more concentrated. Remember that 0.9% is called normal saline. Half of that, so 0.45% normal saline, or so 0.5% sodium chloride means half normal saline. And so 3% sodium chloride is basically 3 times or greater than 3 times as much as that 0.9% sodium chloride. So we're giving the patient a very high concentration of sodium chloride because their serum level that we have measured is less than 120. Now, being aware and knowing how the principle of osmosis applies to this, we have to make sure that we monitor the patient very closely, because as the fluid is being pulled from the cell, it causes cellular dehydration. It can also mean that that fluid is being pulled in the intravascular space, and now all of a sudden we have extra fluid that's coming from every single cell in the body that could accumulate in the lungs. Hence, we have to monitor the patient's lung sounds very, very carefully. The other indication for hypertonic IV solution administration would be head injury or trauma or cerebral edema. So if a patient comes in with a severe head injury, let's say there was a traumatic injury, there's a lot of bleeding and the cells in the intracranial cavity swell. So there's a lot of swelling in these cells. These cells swell and thus can cause mental status changes, confusion, and it can even lead to a coma. So and typically the patient will need other treatments, but one thing that we can do very quickly is administer hypertonic IV solutions to the patient so that we can pull some of this fluid that's caused from the trauma and the swelling from the cells so that hopefully the brain damage that the patient has is being minimized. Another example of an IV solution, a hypertonic IV solution, would be D10, which is 10% dextrose. So that is a very concentrated IV solution that, again, would have more particles coming into the intravascular space. It would not necessarily cause any fluid shifts because, again, the dextrose is used up by the body. Now, D10 usually gets administered to patients who might have had an episode of hypoglycemia, and they may be their MPO, and we really can't give them any oral sugars, so we would give them 10% dextrose and of course monitor their sugar levels, their mentation status, and so forth very carefully. Now, one more caveat. There's several other types of IV solutions, but here are the most common ones. So there's also an IV solution called D5NS. So dextrose 5% normal saline, which is again 0.9% sodium chloride. This solution, as it sits in your IV bag, is hypertonic because we have the normal saline, and on top of that we have the D5 sitting in there. We know normal saline is isotonic, but the dextrose is sitting in the bag with the normal saline, so the concentration is actually hypertonic. Hypertonic in the bag, but as soon as we start infusing this IV solution into the patient, the D5 again gets used up, leaving us with the normal saline, hence in the body it is an isotonic IV solution. So keep that in mind. The nice thing is that all the IV bags that you would administer to a patient have exactly labels of how many milliequivalents of whatever electrolytes is contained in the IV solution that's there, and it'll also tell you the osmolarity of that IV solution. And keep in mind that we can measure the serum osmolarity, so this would be showing up on a chemistry panel, whether that's basic or comprehensive chemistry panel, and that would also tell you that what that serum osmolarity is. So then you can see, is the patient's osmolarity normal? Are they diluted? Do they have fluid volume excess? Are their particles more concentrated? Do they have fluid volume deficits? And then does the IV solution that I'm going to give the patient match whatever their lab values say? Because we definitely always want to make sure that we administer the right kind of IV fluids to the patients. So thank you very much for watching. I hope this was a very brief and helpful explanation of basic principles of diffusion osmosis and how it applies to our patient care, specifically IV fluid administration. Also watch the video on fluid volume excess versus fluid volume deficits, and then the discussion of major electrolytes and how this applies to patient care. Thank you for watching Nursing School Explained. Please leave any comments down below. If you have any particular topics that you want me to go over, please leave those in the topics as well, in the comments as well, and I'll be happy to review the comments and cover that in the future. Thank you very much for watching Nursing School Explained.